Is it visible now? Screen is visible?
No, no. Yeah, screen is visible now. Just a second, it's loading. Yeah, now click on presentation. Yeah, PowerPoint mode. It has been stuck from your side.
Yeah. It's yeah. Is it visible now?
Uh, Click on the PPT, Neha.
Yeah.
I can see your Google Meet ka screen. You left. The presentation is not being
Is
seen.
it visible
You
now?
need to click again on present now. No, you need to click on present now again.
Ma'am, what you can do is you can keep the PPT open on the
Yeah,
backhand
PPT is
and
open.
then don't minimize it and then go on the Google Meet
PPT
and
is open
share
on
a
my
window. You
screen.
do then you might be able to do.
Presentation is open on my screen.
But from Google Meet you haven't clicked present now as of now. आपको एक बार वापस click करना पड़ेगा. Google Meet पे present now.
Is it visible? Yeah, I have done that. I have done that. मेरे
Not
इसमें
yet.
आ रहा है sharing
Let's
a
wait
window.
for
Is it
1 minute.
visible?
I think थोड़ा lagging हो रहा है network. Can you stop presenting Neha and start?
Now it's visible.
Uh, नहीं.
मेरे इसमें तो present now click. I am not able to click on present now because I have already.
हाँ तो you stop. हाँ now.
I have shared with
Yeah, the
you
screen is
also,
visible
Sonu.
now, Neha. Yeah.
Yeah,
Later.
now it's
It
presenting.
is visible.
Okay.
Only the screen is visible. We can't see your presentation. One Click on your power.
You are presenting to everyone. Okay. Now I'll open the PPT. The entire screen is
Yeah, but
sharing.
we can't see anything as of now. We can just see that you are presenting.
It's visible now.
No, no, Neha.
It's visible now. Now
You are
also not
presenting.
visible. It's
It
PPT.
is shown that you are presenting, but nothing is visible what you are presenting. You want me to share, Neha?
Please, I think you only share because I'll just stop presenting from here and I'll try once again. My PPT is open on my screen and I'll try to share a window. The PPT I have selected. I've clicked on share. Is it visible now?
Yes, ma'am, it's visible.
Yes, ma'am, it's visible.
Yes,
PPT is
ma'am, it's
visible now.
visible. Yes, ma'am.
Thank you. Now it's visible. I have started the slideshow.
Yes, ma'am.
Yes, ma'am.
It is visible, Neha.
Yes, ma'am.
Okay. Sorry for the trouble.
Yes, ma'am.
Technical issues do come. So I will present today on knowledge, attitude, and practices. It's just a continuation from the last session what we did on data collection tools. I hope you all remember, girls. So
Yes, ma'am.
I'll just introduce myself. I'm Dr. Neha Lohia from CEG Testers and Research Center Private Limited, Jaipur. I have been promoted to Senior Manager Quality Assurance Department currently from 1st October only. And I'm looking at the quality uh, part for in relation to the testing. what a test house should have as a quality, what documentation they have to do, and how everything has to be in place as per NABL ISO IEC 17025-2017. So our main focus is to maintain documentation for the accreditation from NABL what we have received. Okay, so now we will start with knowledge, attitude, and practices. So girls, what is KAP? Specific population to collect information on what is known. Okay, because we have to collect information of the individual or the population about what they know about a particular topic, what they believe in that topic, and that what has been done in relation to a particular topic. So in most of these surveys, the data are collected orally by an interviewer. So if you are doing a study, you are the interviewer by using a structured and standardized questionnaire. So as we discussed, it has to be standardized, it has to be pre-tested on some pilot population, and then that has to be used by you, and orally you have to ask the question and mark the answers. Okay, and these data can then be analyzed quantitatively or qualitatively. There are some questions you can put where you have to have answers in numbers, or you can code your alternatives or options in numbers, so that quantitatively you can analyze your data. Qualitatively, some views, their comments you can take for some open-ended questions that you can analyze it qualitatively. Then a KAP survey can be designed specifically to gather information about general practices and beliefs. So this will help identify information about general practices and beliefs. So depend upon the questionnaire and what you want to collect from your population. So why we need to do this survey? First and foremost, the KAP survey data are essential to help you to plan, to implement, and to evaluate the objectives and the data you want for your study. Then these surveys can identify knowledge gaps. They can help you to identify cultural beliefs or behavioral patterns that may facilitate understanding and action, as well as pose problems or create barriers development effort. So this will help you can identify your gaps. So as a baseline data collection, you can use your KAP survey. Then cultural beliefs, because you will get to know about the knowledge and the attitude about some particular situation or some particular taboo, if you want to analyze that. Then some behavioral patterns. This will help you to understand and to plan your further steps accordingly. Okay, and it will help you to create barriers development efforts. This means that whatever you're planning to portray, whatever you want to analyze, whatever result you want to implement, this data is going to help you to solve your barriers and to come out of your barriers. Then these can help identify information that is commonly known and attitudes that are commonly held. As the name suggests, knowledge, attitude, and practices. So what is known, what is believed, and what is the practice, all things you will come to know through a KAP survey. To some extent, they can identify factors influencing behavior that are not known to most people. Okay, because every individual have their own behavior, every individual have their own viewpoint. So you will come to know about different behavior patterns, reasons for the attitudes, and how and why people practice certain behaviors. So through your survey you will come to know all these points. Okay, then KP surveys can also assess communication processes and sources that are key to defining effective activities and messages. So through your data you can also develop some kind of intervention or modules which will help you to define your objective and clear your activities and messages properly to the population, to the target of your study. Further, KAP surveys may also be used to identify the needs, problems, and barriers in program delivery, as well as solutions for improving quality and accessibility of services. This will see, if for any study, if you want to have some baseline data, so that will help you to identify your need, problem, and barriers. And then with the behavioral, with the responses, you will also come to know what kind of solutions you are looking for your problems, and how you can improve the quality and accessibility of the services which the people are facing. Then The data collected will enable program managers to set program priorities. That example, to address the most common problem or to identify specific subgroups whose needs may differ from other groups. Okay, so you can set your priorities, which problem is the most important to tackle first, to estimate resources required for various activities, to select the most effective communication channels and messages, to establish baseline levels and measure change that result from an intervention, and for advocacy. So to show the magnitude of a challenge, which in turn may help you to inform your resource needs. So whatever resource you will require, the data will come out from your survey only, because the answers what you get of your questions, the responses what you will get will help you to plan your study accordingly. Then KAP data provide national program managers and their staff with the fundamental information needed to make strategic decisions. Because जब भी जैसे there is some census data or some demographic data, a survey is done. That is KAP survey only, where the data will help the managers or the policymakers to develop their strategy and decide on what policies they have to do and what changes they have to make in the existing policies. So KAP survey is a very important tool for a researcher. So when KAP survey can be conducted? A KAP survey can be conducted at any point in time. It can be conducted in the early phases of a project. When you are starting a project, at that time if you do a KAP survey, it will help you more after the overall programmatic objectives have been and before extensive project planning has been completed. So you have to first plan your extensive project, what you want to do, and then before starting that, you can do a KAP survey to get the entire data of the can resource allocation and project design, and to establish a baseline for comparison with subsequent and post-intervention KAP surveys. So here, if you are planning to have your KAP survey at baseline, then you are liable to do a post-intervention survey also to compare between the two time points. Okay. Then who can conduct a KAP survey? A KAP survey is probably will require internal human resources and along with external experts with specialized skills to lead tasks such as determining the number of people to be surveyed. So the sample size, the decision of sample size has to be done through a statistician. Then you have to design a survey questionnaire. So whoever is responsible for conducting a KAP survey, they should have the knowledge of how to design a survey questionnaire, how to conduct a survey interview. It can be in local languages also, because every population or every target population doesn't know English, or they have their own local language preferences. Then the person should have knowledge about analyzing the data, how to clean up the data and everything. That we will discuss later. Now let me focus on a work plan, a different steps, sequentially steps how the KAP survey can be done, and then we will focus on a example and we will do all the steps of the KAP survey. So the step one is to define a survey objective. As I discussed last time also, girls, when you prepare a questionnaire or when you do any study, you have to have your objectives mentioned in a questionnaire as well. So you have to review the existing information, review literature. What you do, you have to review your existing information, determine the purpose of the survey. You have to identify the areas of inquiry, what loopholes you are finding in the review, what thing you want to find out, what you want to analyze. You have to identify those areas. You have to identify the survey population, and then you have to create a sampling plan. How are you going to take your samples? What is your sampling plan? Then later, step 2 is develop the survey protocol. Then first you decide, you defined your survey objective, then you have to develop a survey protocol. Survey protocol, how your survey is going to happen. You have to organize the contents of the survey, and for that you will have to define your key research questions. You have to define your hypothesis, and then you have to determine whether the survey needs ethical review. I hope you all remember last time I told, if you have human as your subjects, so irrespective you are taking their blood samples or you are pricking them, you have to have ethical approval, ethics committee approval. So you have to determine whether the survey needs ethical approval. Yes, you have to have ethics committee approval. But nowadays, if you have an animal study also, at that time also ethics committee approval is mandatory. Then you have to create a work plan and develop a budget, because every study, every project will require a budget. So see, this is our second step. All these design the survey questionnaire. You have to develop the survey questionnaire. That we will discuss further how simply you can prepare a questionnaire and what points you have to keep in mind. Make a data analysis plan. What kind of data you require? How are you going to plan? How are you going to analyze your data? What kind of test is going to be useful for you? Everything you have to plan. In a project proposal, girl, all these things are essential. Then you have to have your pre-test and then finalize your questionnaire. Pre-testing, pilot study, I have discussed last time also when we had questionnaire as a tool or better survey. You have to choose survey dates and timeline. So how many sample size, how are you going to go about, everything you have to plan. Recruit survey supervisors. Just a second, I'll just have a sip of water. Recruit survey supervisors and interviewers. Then train supervisors and interviewers. Okay. Just recruiting the supervisor is not done. You have to train them. Okay, this is the questionnaire. How you are going to ask the questions, what points you have to keep in mind, how you have to go about. Okay, and then you have to ensure the quality of data collected as well. Because see, for this KAP survey, the population size is too high. So you single-handedly cannot do survey for all the population. So you have to have a team. You have to have supervisors and interviewers. So interviewers will interview, supervisors will ensure the quality of data, and you will then further check the reliability of your data. Okay, then you have analyzed the data. The next step is analysis of data. Clean the data. Girls, what is data cleaning? Anybody can tell me what is data cleaning?
The data
Any
which is
idea?
related to the topic specifically. So you remove the unnecessary data.
Okay. Analyze the data, right? So for analysis, what kind of data cleanup is required? Excel may you have entered your data. Okay. So you have to see to it that no merging and everything is done. All your values are in a single cell. And then the first row of your Excel sheet is the row for your titles. All these things are part of data cleanup. Right? No comma and or no 2 or 3 points in a single cell. Okay, so data cleanup is a difficult task, but if you properly enter your data, then it's very easy and very useful for data analysis. Because when we did our thesis for before data analysis, major time takes for data cleaning only. I hope you know Sharma sir from Vashi. He is a statistician. He used to take lots of time in data cleanup. So when I did my PhD, I used to do my statistics with him only. He taught me how to do data cleanup, and then for my PhD, I did my analysis myself and did the data cleaning. I just took guidance from Sharma sir, and I was able to do my analysis from myself. Okay. Then after cleaning up the data, you have to implement a data analysis plan, what you had planned in your during planning your survey protocol. Then you have to interpret the finding, the results what we are getting. Finally, after analysis, you have to use the data. You have to translate your findings into action. The dissertation what you write, it's your using of the data. Write up the survey report, disseminate the findings. Disseminate the findings matlab you have to discuss your findings from the literature, what is present. Then use KAP survey data in programming. Girls, I hope this work plan is clear now, because next slide onwards, I will start with an example. Anybody? All clear? Okay. So now we will focus on KAP survey. I have taken a cholera vaccination campaign. Okay. For this, a KAP survey is conducted wherein we will collect information on the knowledge, that is what is known by the population. Then attitudes, what is thought of the population, what they think about the topic, and practices, what is done about general and or specific topics of a particular population. In this case, we are taking oral cholera vaccination campaign, and the topics what we include are diarrheal disease, cholera, topic, discussion on cholera vaccine, and then water, sanitation, hygiene, that is wash. Okay, so this I have decided that these topics I will deal in this survey. Then the information is collected by interviewers through a structured, standardized questionnaire that may include both quantitative and qualitative data. So, in case of oral cholera vaccination campaigns, a KAP survey should be ideally conducted before and after vaccination campaign. As we discussed earlier also, when this has to be conducted. So, when we see this topic, cholera vaccination, then as a researcher, we should conduct both before and after vaccination campaign, so that we can compare the impact of vaccination and the impact of the knowledge what we have given them during our intervention period. Okay, so why a pre-campaign KAP survey? This will provide data that may help with vaccination campaign planning. How are you going to plan your campaign, and provide baseline data to help measure impact of the campaign related activities. Okay, so what your pre-campaign survey will give you, the thing I have told you. Then a post-campaign KAP survey will provide data that will help to evaluate the campaign related activities, what you planned after the baseline survey, then what you did during your intervention. The result of that will be evaluated in the post-campaign KAP survey. Got it, girls? Then, should there is insufficient time, if there is less time, girls, and there are less resources to conduct a complete KAP survey, that is pre and post, then campaign implementers or the researchers may also consider using a rapid assessment questionnaire, a checklist kind of thing, to determine whether certain campaign activities or processes, uh, example communication or vaccine dispensing logistics, some part of their campaign they can just check, and if they require, and that is useful to be modified in real time. So the activities what they want to check, because after the survey has been completed, after the analysis has been done, they have to prepare a policy, they have to have some guidelines that will revert, or that will come out of the survey. So if there are less resources, there is less time, so a rapid assessment questionnaire can also be prepared, and to just determine some activities or some processes of the survey. So these assessments may be conducted at any time during a campaign. Okay, then who should conduct a KAP survey? So for this particular campaign, oral cholera vaccination stockpile, the KAP survey will probably be conducted during the early stages of a cholera outbreak response. When we have, so similarly when we have this COVID-19, so now I think studies are going on, or surveys will be going on, or must be going on. I don't have any idea about that, but in case of any outbreak response, a survey can be conducted. So personally, in addition to those involved in the emergency response will be needed, right? Officials who are in the emergency team, or the government officials, or some researchers, or AIMS, ICMR, everything, all are connected. So all can be involved in a kind of main important policy making survey. Okay, then who can conduct this survey? So survey staff can be included, those who have knowledge of survey methodology, okay, those who have knowledge of cholera prevention and control measures, or immunizations, who can help with protocol, and then questionnaire adaptation. So people or the staff with these knowledge can be included. Then assistance from technical partners, with relevant expertise also may be requested, and external interviewers with survey experience may be hired so that the work can be distributed and completed faster. Then we have survey protocol and the development of the questionnaire. So first, as we discussed, a statement of the problem or its background is needed, survey goals and objectives, survey methodology, which will include survey population, survey design, survey sampling plan, enrollment and consent procedures, data collection procedures, data management, and then finally analysis plan. Further, after doing the survey, plan for use and dissemination of survey results. Okay, after analysis, we have to have how are we going to disseminate the survey results. Then we have the ethics review, then we have the budget, project schedule, and questionnaires and interview forms as annexures. Okay, in your thesis also, all your questionnaire and interview forms format will be put in the last as an annexure. So step 1 is review existing information. Before composing a survey protocol, it is important to determine overall goals and objective of the survey. So for this, we will have to review existing information that is related to the population targeted for the oral cholera vaccination campaign, right? So this will include what kind of existing information you will use: local cholera disease surveillance data, wash data, then census report you can use, report from any other health survey, and published literature are your tools for reviewing existing information. Got it? Step 2, determine survey goals. So after you review the relevant information, existing information, next step is to determine your overall goal of the survey. It could be, will the goal of the survey be to explore and collect information about the population or specific topic? First point. Second, will it be to establish baseline data prior to an intervention, pre-KAP survey, right? Third point, will it be to evaluate the impact of an intervention, that is to test a hypothesis about an intervention strategy, or will it be a combination of all these? So you have to determine your survey goals before you start making your questionnaire or you start doing your survey. So for the purpose of stockpile related OCV campaigns, survey goals will be combination of exploration, baseline data collection, and evaluation. So in this particular campaign, we are doing combination of all the three. We will explore the information, we will do baseline data collection also, and then we will check the impact also. Then we have defined survey objectives. So specific objectives for this particular oral cholera vaccination stockpile may include two objectives I have noted down, girls: to assess the knowledge, attitude, and practices regarding what? Regarding safe water, sanitation and hygiene, diarrheal disease, cholera vaccines, healthcare access, and immunization practices among residents of the population targeted for vaccination. So first we will assess the knowledge, attitude, and practice, and then we will evaluate the impact. Okay. Again, evaluate the impact of the OCV campaign on the same points: knowledge, attitude, practices regarding safe water, sanitation, hygiene, diarrhea, cholera, healthcare, and everything similar. Whatever we will assess, we will evaluate also. Okay, so we have two main objectives in this campaign. Then we will have outline survey methodology. Once the survey objectives have been defined, the next step is to outline the survey methodology. This will involve identifying the survey population, okay, then determine the study design, then sampling plan, data collection, and analysis plan. And it is strongly advised that the staff or the technical partners with expertise have to be involved in survey design and data analysis. Okay, because their views, their comments are very much important when you outline your survey methodology. So we will discuss all this survey population and everything in detail. So when we say about survey population, what information you will get about survey population? This will determine by the information review and survey objectives. Whatever is your objective, whatever existing information what you have got, that will help you to define your survey population. In general, this population will be defined by demographic characteristics. Girls, all these points we will discuss now, these will also come in your questionnaire as well. So demographic characteristics, you will have to know the age, sex, religion, whether it is urban or rural, income level, education, employment status, ethnicity, language group, everything are required. So here your questionnaire will also develop. question related to age, sex, religion, everything have to be mentioned in your questionnaire. Then job or social category or other characteristics related to a specific topic. In this case, we are focusing on cholera, diarrheal disease, access to safe water, access to improved sanitation, hygiene. So questions related to these also will be part of your questionnaire. Then selection of the survey population will depend on the survey objectives. What is your objective? To assess the knowledge, attitude, practices of safe water, hygiene, everything. So all questions related to those are important. Then time and resources. If you have more time, you can have a lengthy questionnaire. If you have more resources, you can still have a lengthy questionnaire. But if you are less resource and less time, then you have to focus and develop your questionnaire accordingly. So as different groups may be surveyed, different population is different, interviewers are also different. So you have to prepare a questionnaire in such a way that it is generalized and eligible for all the interviewers who will interview. Then we have survey design. Most KAP surveys are cross-sectional surveys, okay, that collect data at a specific point in time, because there are more interviewers. So at a time, many different sections are covered. Although these types of survey are subject to sampling, response and recall biases, they are the most convenient for situations in which time and resources are unlimited. Because here you have limited time. In your dissertation also you will have limited time. So you will focus on dealing with many sections at a time, right? So for this particular campaign, pre and post vaccination campaign survey should be planned if there is enough time. Why? The pre vaccination campaign should be conducted prior to campaign activities, because this will provide the baseline data that will help to plan the campaign related activities. Then the post vaccination campaign should be conducted within 6 to 12 months following the vaccination campaign to help measure the intermediate term impact of the campaign related activities on the community. So this kind of survey is done in a long term project. In a PhD thesis you can do. For masters, this is difficult. For masters, you can either do a pre survey to collect baseline data, okay, that you can do. Okay, if there is no time to conduct a pre-vaccination campaign survey, a post-vaccination campaign survey can still provide data on health message, delivery modes, and specific knowledge acquired from campaign-related activities. So if there is limited resource, you can still do intervention and only collect a post-vaccination campaign or post-survey campaign also. Then we have sampling plan. The survey sample is the set of survey participants selected from the large survey population. The survey sampling plan will determine how participants are selected and can address the generalizability, certainty, and precision of results by defining who is included in the survey and how many people are needed. So for this, there are mainly three types of samplings are conducted: random, purposeful, and convenience. So I hope you all know what are random sampling, purposeful sampling, and convenience sampling. What kind of sampling you select for your survey sample, it will depend the accuracy, the precision of the results. Okay, if you take जो जिनको पता है मुझे मैं तो उनसे ले लूंगा, so that is not relevant. You either take a convenience sampling or random sampling is the best way of sampling, but that is only possible if you have a larger survey population to have that each participant gets a probability to be accepted as a participant. Okay, then we have enrollment procedure and informed consent. Informed consent, as we discussed last time also, we have to take a written informed consent from the participant that they have been informed about the survey, they have been informed about the objective, and then they sign the consent form for you. A procedure for survey participant enrollment should be outlined, as well as details for obtaining informed consent from potential survey participants. In some cases, verbal consent will be appropriate, particularly where written and signed consent forms are not culturally appropriate or possible. So, most of the cases, in cases where your participant is illiterate, at that time, either you can have a thumb impression or verbal consent. You can have a recording for that. During the consent process, it will be important to assure survey participants that the information they provide will be kept confidential. So this thing you have to mention, or in your consent form you have to particularly have a clause for this also. Then we have data collection. So types of data to be collected are dependent on the survey objectives and questions to be answered. The mode of data collection could be paper questionnaire, smartphone or tablet, because of the technology what has been come up now. It should be determined based on the feasibility of the use in the survey area, again resources for training and supplies, and also availability of technological support in the field during the survey period. Your interviewer doesn't know much about technology, and then still you have given them a smartphone कि तुम ये use करके data collect करके लाओ. So you have to have technological support every time in the field during the survey period. So modes of data backup, because right now backing up of data is very important, because anything can be lost anytime. Okay, paper forms for smartphones, they have to have forms for smartphones also, so that if smartphone gets corrupted or it gets lost, something happens to the smartphone, you should have paper forms also. Okay, then data management and analysis for this oral cholera vaccination stockpile related KAP survey. The data analysis plan should include descriptive analysis. Okay, why? To assess knowledge, attitude, and practices regarding the safe water, sanitation, hygiene. Whatever points they have included in our objective. Then, if we are doing pre and post vaccination campaign, it is possible in the same population. Additional analysis may be performed to evaluate the impact of campaign related activities. So, t-test pre and post का t-test हो सकता है, and then regression analysis can be done also. Then we have developed the survey questionnaire. Tips for survey question writing. You have to remember the purpose of your survey, girls. Make sure that the survey questions support the survey objectives. So whatever questions you are writing in your questionnaire, it has to be related to your survey objectives. Then if in doubt, throw it out. Okay, if you have any doubt in the question, don't include. If the effectiveness of the question is in doubt, again delete it. If you feel like after reading the question, इस question से जो answer आएगा वो मेरे को relevant नहीं, delete it. Okay, keep your questions simple. Use simple language. In each question, focus on only one topic. Don't mix 2 or 3 points in one question. Stay focused and avoid vague issues. Avoid leading questions. Okay, use neutral questions that will not lead the participant to answer in a specific way. Any questions, if you have a direction in one point, then your respondent also will answer in a specific way. So don't use leading questions, use neutral questions. Make sure the respondent has enough information. That is, providing some background for a question may yield more accurate data, more accurate information. So, for example, I'm just writing a question. Rather than asking, do you think that the oral cholera vaccination campaign was beneficial? So this is you can use a 2-part question. This is again a leading question. Okay, you have to have a neutral question. Did you know that oral cholera vaccine was provided to people in this village during a vaccination campaign last month? You are asking कि उसको पता है कि नहीं कि यहाँ पे कुछ last month में हुआ था. After that, you can ask, what kind of benefits have you seen from this campaign? Okay, so you are not asking a leading question, you are asking a neutral question. क्या आपको पता है कि ऐसा कुछ हुआ था? Okay, if you say yes, then what kind of benefits have you seen from this campaign? Okay, so you have to think over and prepare simple questions for your survey objective. Then again, for this this kind of campaign, the following question topics can be included. As we suggested, demographic and socioeconomic characteristics questions will be required. Then questions on knowledge, attitude, and practices regarding diarrheal illnesses and cholera, wash, cholera vaccines, and other routinely administered vaccines. Other vaccines also relevant to the hygiene and sanitation and healthcare access are important. So you will have to have the details about that also. Then thirdly, exposure to health communication and messaging regarding diarrheal illnesses and cholera vaccine. Okay, whether how the population are exposed to this kind of services. And then observations of household characteristics, water treatment and sanitation facilities in the household. So you have to observe whenever the interviewer will interview. So there has to be some observation questions. Observation, you don't have to write in your words. You have to have questions. What all things you have to observe. So in this as we discussed previously, the questionnaire is structured and the questionnaire is standardized. So the observation points also will be included in a questionnaire only. Then lastly, step 6 is we have to determine the requirement for ethics approval. Each survey protocol should be considered for approval by an ethics committee. Ethics committee will review the research protocols to ensure that study procedures adequately protect the study participants. Okay. Thank you, girls. I have done with my presentation. Any questions?
Yes, ma'am. Ma'am, can you hear me?
Yes, yes, Farzan.
So my question is, in the initial times you said, if whatever your aim, your objective of the research is, you need to have topics
Mhm.
related to that, which will be questioning in the questionnaire, right?
Yes, yes.
So how do you figure out what could be, how many topics would you be, taking into account, and how would you figure out the topics which you would be including? Specifically.
Okay. Yeah, for this again, when we discuss about, we have to review the existing information. From that only you will come to know, okay, for this relevant topic, what all things are coming up, and then you will come to know about, okay, I can focus on this point, this point, this point, and that time you have to decide upon your objectives, your research questions. So all the data from the existing information only you will come to know about what topics you have to take for your topic, for your thesis. Got it, Farzin?
Yes, ma'am.
Any other doubts, girls?
The
Any other?
presentation has been mailed to Sonu, so Sonu ma'am will share with you.
Sure, sure.
I think the example what I have done, taken, it covered all the points with simple answers. So I hope the girls have understood the thing.
Any questions, girls, for ma'am related to KAP? Did you understand?
Ma'am, if you have any doubts, you can get back to you through email, right? You have
Sure,
given us.
sure, Farzin. You can mail. You can mail. You have my
Okay,
email
thank.
ID. So you
Yes,
can
yes,
mail.
ma'am. You'll send later.
Yeah.
Okay.
Yeah, when you will actually work for a topic, na girls,
Yeah.
that time you can have doubts. So you have this presentation, you go through this presentation, prepare your questionnaire and everything, and then if you have any doubts, you can mail me. I will be happy to revert you with whatever knowledge I have.
Great, great. And thank you so much, Neha. I don't think they have any
Right.
questions now because once they will start working, then only they will actually
Yeah,
have
they
questions.
will come to and they will have doubts when they will actually start working now. At that time, they will have doubts, so they can contact me anytime.
Probably in this month they will start working because their ethical clearance is in process. Once
Yeah,
they get,
October na. Yeah.
yeah, so they will start. So thank you so much, Neha. On behalf of UGC Stride, I thank you. And if they will have any doubts, I'll surely get back to you. If they require,
Yeah.
I'll keep one more session according to their
Okay.
requirement.
Okay.
Thank you so much, Neha, for joining.
Okay. Thank you so much.
Thank you,
Thank you.
students.
Thank you.
Yeah.
Thank you, girls.
Bye, Neha. Bye, students.
Bye.
Bye.